This is Dr. Kelly, sharing knowledge, liberating minds. Hello there. Thank you so much for joining me on another edition of your number one educative online podcast, Dr. Kelly. Now, in today's edition, we'll be talking about common bone and joint disorders. Common bone and joint disorders. Today, we'll be looking at the common bone and joint disorders that people often battle with. What are their causes? What are their complications? Can they be prevented? What are their possible solutions? These and many more are the things we'll be talking about in today's edition of Talk to Kelly. My name is Sarah Adino. Thank you so much for tuning in. Sit back, relax, go nowhere. Trust me, this edition promises to be exciting. Now, if you have questions with regards to this topic, you know anyone battling with a bone or joint disorder, any one of them at all, please, this is the best time to share the link with them. Share the link with them and get them to tune in and let us do this together. You have questions or you would like to contribute, you would like to share your personal experience, make use of the comment section. We will be doing this together. Now, in the studio, I have with me one of my friends. Yes, I'm pleased to call him my friend. He's our very dear Mr. Segun Saliu Ajayi.
Wow.
Thank you for coming to Dr. Kelly today.
Oh,
How do you feel?
I feel excited,
Okay.
and I'm happy to be here for the first time to meet and present to my people of Kedi, the family, talk to Kedi, life and narrate, at least to share knowledge with them,
Exactly.
what you have been learning for so far about the company and their health, what people have been battling with.
Yeah. Okay, so for the purpose of those who probably do not know you, can you introduce yourself quickly to my viewers?
Oh, my name is Saliu Segun Ajayi.
Yes.
I'm from Ogun State. I joined Kedi 2016, and I'm a stylist consultant in the business. I've gotten Kedi car, I've gotten Kedi traveling. I have seen them I've traveled, I've qualified for cars, I've bought cars, I've built houses as well.
Wow.
And to God be the glory, we had a lot of exciting lives that we have touched. And this is one of the most amazing things that Kedi Healthcare can help you with. If you want to be a philanthropist, join Kedi because it makes it much cheaper.
We didn't know this before. I didn't know some of this before, but don't worry, we'll talk about that later, right? All right. Mr. Segun Saliu Ajayi is one of our seasoned consultants. He's one of our dynamic lecturers, and of course, he's the owner of Kedi Service Center 589, located in Ikorodu, Lagos State. Trust me, I am certain that you will learn a thing or two from him today. So please sit back, relax, and let's do this together as always. Don't forget to share this link with everyone you know. Let us all come together and learn about common bone and joint disorders. In case you're tuning for the first time and you're wondering what is happening here, this is Dr. Kelly, where we share knowledge and liberate minds. This podcast is coming your way from the stable of Kedi Healthcare Industries Nigeria Limited, leading provider of quality healthcare products and services in Nigeria. Yeah, that's on this podcast. You get to know all that you need to know about the company. You want to know who we are. You want to know what we do? You want to know our reach, our coverage, how you can change your life by joining us? Trust me, this platform is your best bet. Okay, it comes your way fortnightly, every 2 weeks, on Thursday by 12 p.m. So trust me, you can afford to miss any edition of Talk to Kelly. Now, let's go back to the business of the day. Our topic once again is common bone and joint disorders. Now to the statistics. According to research, Nigeria alone records about 1.5 million cases of joint disease every year. I take that again, and that's a fact. According to research, Nigeria alone, Nigeria as a country, records about 1.5 million cases of joint disease every year. This statistics is not limited to the age, because I don't know where this opinion is coming from. Some people feel that joint and bone disease is for the elderly ones alone. It is not true. It is not true, okay? So regardless of age, regardless of gender, joint and bone disease is real. Trust me, it's real. When I hand over to my guest, I'm sure he will take us through the nitty-gritty of this topic. What are those things you need to know? How can you prevent it? I'm sure these disorders are preventable. Some of them are preventable. How can you prevent them? Okay, what are the causes, and how do you know you have them? Apart from the regular joint pain or maybe a pain in the bone, how can you know that you are susceptible to these disorders? In the next few minutes, we'll be talking about them. Okay, so please do not go anywhere. Now, joint and bone disorders are not a function of gender or age. Whether you are young or you are old, it can affect you. So don't say, okay, this one are old people. Now old people get to the topic, so maybe I dey go. Me, I'm still young, it's not happening to me. Honestly, and do not forget that I always say that as a Kedi consultant, you must know something about everything. Okay? Don't say since you're not battling with any bone or joint disease, there's no point watching to this edition. That's not true. As a Kedi consultant, you must be an all-rounder. You must be knowledgeable about almost everything. So that when you go out to prospect and you're asked some questions, you can boldly stand tall and provide answers to those questions. Okay? So please don't forget that you can be part of this conversation in the comment section. As you tune in, make it on the comment section and let's get talking. You can share your opinion, you can ask questions. Okay? If you have questions, please start sending them in. Before the end of the broadcast, our guests will do justice to all your questions. Now, let's go. Mr. Shegun, are you ready? Sure. Is the seat not hot? I mean, okay, good.
This is a family program, so
exactly. Yeah, they're discussing with your family members. Yes. Okay, right. Let's do this. Now, my first question for you is, without missing words, okay, and for the purpose of easy comprehension, I want everybody to understand, okay, because maybe joints and bone disorders may sound a bit technical to some people. What exactly do you refer to as joints and bone disorders?
Okay, thank you. What about bones? Simply talking about the skeletal. What talking about bone? Simply talking about the skeletal part of the body.
Exactly.
It's just like we're discussing about pillar of the house. You can't have a house, you can't have a structure without having a pillar. So the skeleton is actually what makes a human, a man, a person. And you can stand, you can do something, that is your bone. Then the joints are actually just like an electric wire that helps you in passing out of blood in connection of one of the bones to function properly. These are what is called joints. So we're not talking about the disorder, that has to do with what are the things that will affect those bones not to perform their duties. Then what will be the conditions of the joints as well, not to be able to pump blood, to circulate blood properly to most of the parts of the body system. That's what we're talking about bone and joint disorder.
Now, I'm giving you all the time in the world, okay? I want you to take your time to explain to us, and taking them one after the other. What are the common bone and joint disorders that people often battle with? What are those common ones? I know we have some other ones, okay? What are those common ones that people often battle with? Feel free to, share examples. If you need to make use of your body to show us, because I really want everyone to understand what the topic is about. So, can we have some of those common joints and bone disorders?
Okay, talking about common bones and joint disorders, that we have over 200 bones on the body anyway. Now, and we have a lot of bone diseases. So, but there are most common, which are like about 5 of them. We'll talk about osteoarthritis, we'll talk about osteoporosis, we'll talk about gouts, we'll talk about bruises. So, which I'll try in as much as possible to break one or two of them down to let us know the one that we are experiencing. So, you'll be thinking that, oh, I can use this A, the approach for A to attend to B. They are both different things which you need to know. Example, like one of them called osteoarthritis. That has to do with the common bone disorder that affects the joint itself. When the cartilage in between two bones, we have, just for example, now, in this area now, we have two bones here, which in between there is a cartilage that makes those bones not to connect. So once the fluid of that area is actually rubbed off, then the bone touch each other, then challenge comes. That's what we're talking about, osteoarthritis, which most of the times makes most of our elderly ones not be able to move properly, and it most affects most women from their 50s, 60s, 70s as well. But now we are having most of these ailments coming down to our own age.
Exactly.
Then it used to be the old age, but now we are having more of we that at this age even complain having more of those issues. That's what I'm talking about osteoarthritis. Then what are some of the symptoms you can experience when you are having osteoarthritis? You can experience swelling. Swelling in the joints, part of the body, the area affected. You can experience swelling from it. Then you can experience stiffness, like something is being stiff. Sometimes you can't move. So sometimes you can experience that when you're having osteoarthritis. And what are the causes of this osteoarthritis? Family history. Because it can be, it's a degenerative disease sometimes that you can experience. It can affect one family and it can be transferred. Like in the history that, oh, my mom had this, my dad had this, so you can experience that as well. Another thing that will cause this is overweight. So when your weight is high than the weight is supposed to be, medically there is what is called BMI, that is body mass index, the level of weight over the height. So there is what your body can carry, what your bone can carry. So you don't say, oh, God has blessed me, so let me just eat more, let me enjoy myself. Then you're adding much more weight and adding more danger. You will say, that is just in the meaning of that, like you're actually causing your problem. One of the doctors said that we human beings are the one that will eat ourselves to really breathe. And one of the doctors says that you are what you eat. So which more of the time, these things we experience are what we do. Sometimes we know, sometimes we don't even take it. Some persons is sitting out there at home and say, oh, I'm still young. Meanwhile, you are already getting to that age gradually. If you check down, your date of birth is different from that of last year to now. So gradually you are getting older, and most of these things, you do them daily, day out, and they affect you. Then we have the second one called gout. So gout has to do with the painful condition affecting the joints. Gout affect the joints. Then when there is gout, which most of the time affect most of the ankles. Whenever you have ankles where you have this side, so that is gout, when you experience gout. So most of the times it's common to most women.
Women again.
Yes, women at their middle age. So gout affects them a lot. There are some of the symptoms they experience, which is sudden swellings. So there is some and causes pains in the joints. Then it's of course most of the time during at night while you're sleeping. So yes, that is most of the time you experience gout. Then sometimes you can feel experience it here at this thumb side. So this thumb side, so gout. Then what are the causes of gout? One of the causes of gout simply means is by when there is blood level of the uric acid is very high. So what do we say about uric acid? Uric acid has to do with the byproducts. The byproduct from proteins, from animal protein. Once it's excess, it affects your kidney, and from the kidney this gets back to the body system and some part of the joints. So which this is one of the problem. So you can now see that if you want to treat arthritis, start from the way you attend to gout. So that's why I say you don't use all the same approach for the same ailment. So then we have another one which we can look at, which is called osteoporosis. Osteoporosis has to do with, if you look at that word, it's two things. Osteo means bone, then porosis means holes. That simply means holes that affect the bone, which is most common to people that have diabetes. Then most of the time, it makes people to reduce in their level of height. It reduces up to like 6 inches. Somebody will be getting like maybe 1.8 meters, and before you know it, you start getting shorter, reducing because of osteoporosis. So what are one of the factors that could cause osteoporosis is when you live more on alcohol, or you smoke a lot, or you like taking drinks. Most of our ladies nowadays, they will express more of this. Why? Because most of them does not really like eating normal food. They don't eat living food, they rather eat dead food. Like living more on minerals, on junks, on some of the noodles, which I would not like to mention, the brands, so which they live on. And in taking more of all this, they affect and damage the bone in the nearest future. So these are some of the things we can do. Then let's look at rheumatoid arthritis as well, which is a long-term autoimmune disorder that affects the bone. So when we're talking about autoimmune disorder, simply means instead of the immune is now attacking that bone. That is RA, rheumatoid arthritis. That as well also is one of the conditions that causes bone disorder, bone and joint disorders. One of the symptoms you can experience is the morning stiffness. In the morning you feel stiff, probably you want to get up from the bed, you won't be able to pick the leg to move. You get stiff, then that'll take about an hour, then you can start coming up of bed. That's the that are already experiencing what's rheumatoid arthritis.
Let me just check this. It's a question, but of course, off the street. There are some people that when they get up or something, their body doesn't, or when they stretch, their body will make a sound. Do you understand? Yes. When they stretch, you hear different sounds in the body. One is the good thing. And two are those things. I mean, some people say loud sound. You hear that, bang, what is happening there? Is it the bone or what? I'm just curious.
It is the bone. Because one, when you lack exercise, that's one of the reasons why I'm saying that you should do more of exercise. And though I'm still going to give most of the general things you need to be doing daily, what you need to do part of us every day, which you need to do to keep fit. Because most of all these things can actually be preventable. But once some of them have happened, some of the time they are not curable, they are not curative. So, but they can be preventable most times. But once they happen, some of the time they can't cure it. They can only manage. So talking about the rheumatoid arthritis, then one of the cause of that is mainly not unknown, but most of the time infection triggers it. When you have one or two other challenges factors in the body, can as well cause that. Then when you take excessive antibiotics, can reduce the level of immunity, which sometimes can affect that and cause rheumatoid arthritis, and some other things as well. Then hormonal changes as well can cause that. So then we have bursitis, which is the swelling and irritation of the bursa. So what we mean by bursa, which this is actually doing the fluid sac that acts as a cushion between the muscles and tendons and the joints. That's what we're talking about, the bursitis. So what are the symptoms you will experience? The pain and the tenderness when you press around your joints. Sometimes it's just like a bit like water or something here in most of the parts of the body. That is bursitis, which you can experience little swelling. Then you experience, that is one of the things you can experience about that. What are the causes of this? Overuse or changes in activity level. Overuse or changes. What do I mean? For example, let's take an example of most of our parents. Some of them that when they used to they love going to work, doing all of the hardest activity. They are like, oh mom, you are not old, just stay at home. So in the next 1 week, 2 weeks, you notice that most of what the woman does not complain for years will start coming up. Why? Because that person is not used to that kind of lifestyle. You see somebody like maybe used to cooking, then now some of them like, okay, 1 week relax, 2 weeks relax, then you will experience more challenge. Some of the time they feel most of all these things. Some of the example is changes in activities they could experience. Then what are the prevention? Avoid activities that will cause that. These are some of the 5 major ones. Common rheumatoid arthritis, bone and joint disorders.
Alright, so if you're just tuning in, this is Talk to Kelly, and our topic still remains common bone and joint disorders. You see, this bone disorder issue is a serious one. So I I urge you that tune in, make use of the comment section and send us your questions, okay? In the next few minutes, I will move into the comment section to take your questions. What? If you have examples to share, you would like to share your contribution, like you would like to contribute, like to share your examples, personal experience or whatever, just make use of the comment section and let us get talking. This is Still Talk. Today, I will still have Mr. Segun Ajayi in the studio with us. Okay, as a career consultant, please tell me sincerely, how complicated can this get? Like, is it deadly? Bone and joint disorders, are they deadly? And how complicated can it get?
I will say yes and I will say no.
Okay.
It depends on the way you attend to it.
Okay.
We are some persons that when they express, if they are having a symptom of this, well, I don't care.
Oh.
Some does not even think it's normal now, I'm working and they just leave it like that. Meanwhile, but when you attend to it on time, then it can be worked on and there will be solution on time. But when you leave it for a long period of time, you don't address it, usually the rheumatoid arthritis can cause a lot of damage. Can cause a lot of damage. Then the osteoarthritis as well can cause a lot of damage. It can even cause paralysis, can even cause somebody not to be able to move. So then a lot of issues can come from that. So if that is happening, and then human beings are being made to move from one position to another. So when you cannot move, you just be in one position. Everything you are eating simply means you are in one position, everything you do. Then other factors you can even trigger can come up as well through it. So most of the time, if care is not taken, it can be deadly. Depends on the person that is expressing that.
That will take us to lifestyle habits. What are those lifestyle habits that predisposes us to this bone and joint disorders? What are those things that we do on a daily basis? Some of those things don't even take cognizance of them, no matter. You know, what are those things that we do? What are those lifestyle habits that predispose us to some of these disorders?
Okay. One of the things that will cause that is one of the lifestyle we do. We are in Lagos. So let me use our lifestyle in Lagos as an example. For example, now you work on the island and you live in maybe in some areas very far, about 3 hours. In Lagos, you know you can drive 4 hours and you're inside traffic. Why? So, and you're supposed to resume to office by 8, which means you just leave the house as early as 4 a.m. Then you see on the road, you buy in the traffic, maybe one of the soft drink you take and gala. All this lifestyle you are doing, you are damaging something in the body. Something is there that you are damaging, affecting every day. And one of the things you are affecting, once the excess of those glucose are much, you know that already affecting your bone. Don't forget that we talk about osteoporosis. So, which is one of the things that's to trigger. Okay. Then when you live on more of fats, like meat, chicken, turkey skin, and the likes, then you are getting much excess uric acid from that, which is going to cause gout. Okay. So, which you need to know what to do. Then if your weight is getting much more, you're having much weight, excess weight, your BMI, you don't check it. Then once your weight is more, then you know you're affecting the bone. Which are some of the lifestyles that we do. So which is supposed to be keeping ourselves fit. And we're even now in a comfortable environment now that some persons, they live in the AC house, the car has AC, the office has AC, the restaurant where they eat AC. So everything, they don't even sweat a bit. Which there are toxins that are not supposed to be in the body. We're supposed to be sweat out, supposed to take them to meet those toxins out of the body system. So there must be an activities put in place, either registering into a gym or doing a lot of exercise aerobic activities in the morning or in the evening. Maybe you live in an upstairs house, you walk up the stairs or you dance.
You can even buy KDBCM.
Machine. So
set it out.
That is going to help a lot. Or you get a VIP massage.
Exactly. Okay. Okay, all right, thank you. So this is Still Talk to Kenny. If you have questions, this is the best time to send those questions in, because in the next few minutes, I will be taking your questions, okay? I would not want a situation where my guest leaves and then you start sending in your questions. So please send in your questions now so that you can do justice to them. Okay, so you've talked about those things that we should avoid. Apart from exercise, what are those other things we should inculcate? I think one of them should be drinking water. Some people don't drink enough water. That's just my own personal opinion. So what are those other things, lifestyle habits that we should imbibe? Okay,
there are things we need to do. Regular base. Number one is that you should keep fit at all time. Keeping fit at all time, you really need to keep yourself active. So it's not just about talking alone, but at least to keep yourself fit. How do you keep yourself fit? By eating what your body really needs. And there are vegetables that are meant for bone.
Okay,
for example, like cabbage.
Okay.
So it helps, it has a lot of calcium in it. Snail.
Oh, okay.
Then beans have a lot of calcium.
I get it.
Mostly the white beans. So which when you take them often, they helps our bone formation. So to help our bone to be much more stronger, there are a lot of vegetables, different kind of vegetables you can lay your hands on to eat them. But more of raw vegetables, they help the body more. Then you talk about water, then more vitamin C's. Then which you need to take a lot of food that are rich in vitamin C's, they help in bone stimulations and which are going to have a huge bone.
If you cannot even consume all these advisable, but if not, if you are deficient, you can also make up with Vika.
Vika, sure.
Vika, multivitamin, and use that to make up for, okay, alright.
Yes.
Okay, so I also think we should address this. When it comes to keeping fit, some people think it's a big deal. Say, I cannot go to the gym. Okay? There are other soft ways you can do this thing. Right in the comfort of your bedroom, you can keep fit. I'm telling you. Right there in your house, you can keep fit. Just make it, be consistent. Do you understand? Don't do it and then the next time you do it next year. Be consistent. If it's 5 minutes daily, you can do. If it's 10 minutes daily, you can do. Whatever works for you, depending on your daily schedule. Do you understand? For example, you're like us, you leave the house early and then you get back late and all that. If all you can do is 5 minutes a day, you just move your body. You can jog on the spot, you can stretch, you can do some simple things, but please do something. Because during the day you have amassed a lot of calories. Sure. You have amassed a lot of calories and you probably did not burn them out and you want to go to bed. Please ensure that you burn some of them out in whatever way you can. Okay? If you can skip in your room, please do it. If you can skip in your room, if it works for you, do it. If all you can do is just stretch, some sit-ups, some of those
push-ups and all that.
Yes, that's what you can do. Please do it. And another thing, talk about eating right. Okay? You get to, I don't know, let's talk about this. At some point in time in life, you get to a stage where it is no longer about the bulk of what you consume. Just what you consume is no longer about the bulk. Food they get you shop. You go there, you go to Mr. Shem's house, you chop. You go to another place, you chop. You go there, you chop. I mean, it gets to a point you have to start scrutinizing what goes inside your body. Very, very important. Sometimes we eat things without some of us don't even know calorie check. There's something called calorie check. Before you eat a thing, look at, in fact, that is what I do now. Before I eat anything, in my mind, I calculate the calorie. There's something called calorie check. The amount of calorie you take in, make sure you're able to burn it out before nightfall and sleep. Because some of us are getting obese and you're wondering, what did they happen now? It's not like I'm comfortable. I'm not trying to go to, I don't have money, what am I adding weight? Sometimes it's some of these things. Do calorie check and then stretch your body. Burn it out as much as you can, as much as your daily activity can allow. Okay? It is very, very, I'm not a doctor, okay? I'm just giving you my personal opinion, but trust me, it is very, very, very important. Okay? So let's go on. Now, what are the Kelly products? I know that Kelly have some products. Kelly has some products for bones and the joints. Okay, so I'm sure that many of people watching us would like to know what are the Kelly. We have mentioned the rheumatoid arthritis, osteoporosis, gout, and all of that. What are the Kelly products? Because I'm sure that some of people watching us will either have some of these disorders or know someone that has just an Okay, so let's help ourselves now. So, what are the Kelly products for some of these common disorders so that our viewers can get these products and then start working on them?
Wow, thank you. First and foremost, Kelly has a lot of exciting products. We have about 46 products, herbal medicines and supplements. Some of them are for several ailments and conditions someone might be experiencing. Now, discussing about the bone, we have different types of products. We have physiotherapy machines that even helps when the condition is much at extreme, or you don't want to have that. You want to prevent yourself from that. So talking about our products, we have one of the products designed for bone called Joints. So if you look at the word joints, so joints is. That's just the simple way I put it. So Joints actually helps to work on the level of osteoarthritis to make it calm and make it normal. Joints has a lot of functions that it works on the bone that somebody made. Then we have Golden 6. Golden 6 works on the level of hormone. Because talking about most of these bone issues that we're discussing about, one of them, you can't put age factors aside.
Okay.
Most of our women, when a woman gets to about 45, thereabouts, they get to the age of menopause. So which is one of the symptoms they experience, one of the ailments they're bound to experience in that time could be as a result of this bone and joint disorder. While men, with the age, they are only call it anticultural year. So which sometimes one of the things they could experience is this as well, and sometimes erectile dysfunction for men. But some of the men also experience it. But it's most common in women. Why? Because they lose most of the vitamins and minerals that makes up the bone and joints in different ways. Number one, the woman loses that during when she's getting to puberty stage when she menstruates. So the blood coming out every month is releasing most of all these nutrients and minerals that the body really needs to form the bones and joints. Secondly, when the lady now gets married and has a child, not pregnant, then at the trimester level, whereby the baby is forming the bone and the joint, the baby inside the womb is extracting most of these minerals and joints in part of the body. Then the third one is during the childbirth. The blood and water that come out that day, the woman is also losing this. Then the other one is during the lactating period, breastfeeding. And aside of this, couple the fact that it's difficult and the case we say that men work more or stress more than women. In fact, you can even say 50-50 or even 60-40.
Oh,
because most of our women now, even aside of all the activities in the house, they will still have to do more of the things outside to work.
Exactly.
To still work and do more of the things they have to do as a person in the house as well. So most of all these affects. So these are the reasons why we waste all the products. If your weight is much excess, I will first advise you come on your weight with any product and lifestyle. Like I rightly said, the calorie intake, measure into the calorie you use every day. Number one, then which will help your weight to come down to normal. Then two, we have product for weight in Kedi, which we have Magilene.
Yes.
We have Magilene, I call it Magic Slim.
Oh.
So Magilene actually helps your body to keep fit, to work on the level of cholesterol and the calories to maintain. We have Constellis for those that actually want to work on the level of their tummy to keep it flat and the butt. Then the Magilene works on the general weight where there is excess fat and cholesterol in, which maintain and perfect it. Then we have colon cleanser, which helps to detoxify and as well to more powerful excess weight in the body that the Magilene and the Constellis has worked on. So that is if you are having excess weight, that is one of the cause of the bone problem. So when you first address that, you have done that, then you can now work on the bone formations, then you take the joints. Then we have Calmazine. The Calmazine contains calcium, magnesium, vitamin E, which helps the bone formation. The nutrients and vitamins that you have loses as a woman and as a man, they will actually make it back. I talk about the way women lose theirs, and I never talk about the women, which I know most of our men want to know. Men lose most of their own calcium, vitamins, and minerals due to sex.
When they ejaculate.
Yes, when they ejaculate, they loses more of that. Then they also loses more.
What is going on?
Someone is laughing. I don't know why the listener is laughing. So they tend to lose more during that, and they lose more during stress.
Yeah.
During stress, because men do more mental work. So women are more in the emotional, they can talk to why men will just keep quiet. Meanwhile, it's keeping quiet, a lot of things, a lot of departments is going on there that are being active. So in doing this, they are losing more of them that they use through this medium. So I'm talking about weight, and then after you have maintained a balance of weight, that's why you can use the product to work on the formations, areas you actually want to affect in the body. So we have different products. I'm talking about joints, I'm talking about Golesis, Calmazine, then we have Vika.
Yes.
But taking the Vika has to do with your glucose level. If your glucose level is not excess, it's not high, then you can take it. The Vika actually is meant, it helps for the children, the babies. They need it more. Because most of our baby nowadays even complain bone problem. So before they start taking joints, taking Calmazine, taking all those ones, once they take the Vika can help them to get virtually everything needed.
Okay.
Even sometimes some persons have the calcium, but because they lack vitamin C, then the calcium will just be there and all that.
Okay.
So which they, once they take that and vitamin C, it helps the body to be able to make up every vitamins and minerals in the body.
Okay.
So which you take the Vika, the tablets in a day. Just drop it in the water, you go along with it anywhere you want to go to.
Your water bottle.
Your water bottle.
Inside your water bottle with water. Take it everywhere.
So and it actually helps our baby to keep them out of excessive hyperactivities. Because of the children nowadays, I said they're hyperactive. So which means a child is meant to be active. Aside of that, you still now give more of excess glucose. So and the more you give this, they have to burn it.
Yeah.
And if they don't burn it, it will affect them. So meanwhile, you are the cause. So instead of this, just give them Vika, they normalize their health.
Thank you so much, Mr. Shegun. So, Mr. Shegun has talked about the possible solution. Let me just retrace, because while he was talking about the solution, this thing just dropped my mind again. Let's retrace the fact that prevention is better and it's also more affordable and more convenient than cure. Do you understand? Prevention is everything. So you're watching and you're saying, okay, I don't have these disorders, so that it is good now. It is good that you don't have them, okay? But it is better for you to prevent them from coming. Do you understand what I mean? Okay? We have mentioned it and let's just run through it again. If you don't get anything from this podcast, please get this. You can prevent these disorders, okay? If you have them already, no problem. Mr. Shegun has talked about how you can handle them, okay? But if you don't have them yet, please take notes. The first thing is check your lifestyle habits. Check your lifestyle habits. Some of us, our lifestyle habits are honestly nothing to write home about. After downing unhealthy meals, you will now wash down with alcohol and just go to bed like that. You don't burn it out and then you accumulate it, not like accumulating your points. As you accumulate your PV, just fine. You accumulate it like that and then you start calling consultants and you start stressing them out. Very, very important. Please check your lifestyle habits. Drink water. So people act as if water you have to pay for it. So people act as if you have to give your long life and prosperity in exchange of the water you drink. No, water is free.
And water is life.
It is life. Please drink water. Stop rationing water. I'm telling you, I know what I'm saying. No. You see this one bottle, some people can drink for 1 week. And what is going on? Please drink water. It helps, it flushes out all of those phenomena that you don't even want to know. You don't want to know what adjusts to your body. Please drink water. Some people say, I don't feel like it. You have to feel like it. You feel like taking soft drink.
Yes.
You feel like taking soft drink. You feel like it, but you don't feel like taking water. Feel like it. Make your body feel like taking water because it is beneficial to your health. I'm telling you. Drink water. You wake up in the morning, please take water. It flushes out toxins. You see, as you go to urinate, you don't know what is leaving your body. Please take water. That's one. Number two, eat healthy. It's not about the bulk. It's about the quality of what you put into your body. Please check for quality. Now, I know someone saying, in this Nigeria that we are now, we get money to buy quality. Now let me say what I mean by quality. I'm not saying buy something expensive. I'm saying check what you eat. How much is vegetable now?
Right.
Everything costs, vegetable costs. Do you understand? Eat healthy. Just know how to rightly balance everything out. You can have vegetables, you can take fruits. How much is watermelon? Don't make this look like a big deal. How much is watermelon? Please, I'm telling you real life things. I'm not a doctor, but I'm just telling you things that work. A day should not end without you taking fruits. I like.
No.
And then they be the doctor. I'm not a doctor. But trust me, a day should not end without you taking fruits. If possible, vegetable and then lots of water. Imagine you take fruits, you take enough vegetable, then you take lots of water in a day. Now let's move on to the next one. Exercise. Exercise. Anytime we mention exercise, people feel I must go to iFitness, okay, or go to any other gym anywhere. You can do the basic ones. You can do the basic ones, but please ensure to be regular, be consistent. Okay, it helps. Your BMI, like I talked about, is very, very, very important. And then check calorie whenever you eat. Okay. For whatever reason, whether you work or not, please ensure not to sit for long hours. Ensure not to sit for long hours. If you work, if you do our own kind of job that you have to sit with the system and all that, once in a while, maybe every 30 minutes, stand up. Stand up and just walk the stairs. Just walk up the stairs and walk back. You are not looking for anything. It helps the body. Just stand up. Go back to work. After 30 minutes, maybe 1 hour again, stand up. You can just go up the stairs, or just if you don't have staircase in your own office, you can just go around, check around, come back, continue work. Later again, you stand up. All of it. Don't just sit. You are seated for 9 full hours. And then you get to, and all of these things, they affect, they are, honestly, please check, it is very, very important. I can go on and on and on and on, but please check your lifestyle. Do you understand? It is very, very important. Now, time is no longer on our side. Let's just go to the comment section and take your questions. Mr. Sheikh, are you ready?
Let's try.
We have quite a number of questions here. Let us start because of
Actually, a lot of persons are experiencing this at home.
Hey, let me take this one because this particular, do you know why I'm starting the question, man? Mrs. Bennett Appa. Since Tuesday that we released the awareness post, she said, I'm waiting for this podcast. So this broadcast is very important. I'm waiting for it. So I'm going to start with that question. She said, please, what's the best way to treat, okay, he has mentioned it. What's the best way to treat this bone disorder? I learned that it is not treatable. Is that true? If it is treatable, what kind of products can we use and how to use it so as to do away with it? Number one, which of these disorders are we even talking about?
So,
Do you understand? Because he said something earlier. He said you cannot use one. That you cannot use the solution for one for the other.
others.
So, Mama, which one exactly are we talking about so that we don't mix things up? The one for osteoporosis, we don't give it one the solution for that. Just stand. So please let us know which of them exactly. So that's why we took, I gave him almost 15 minutes to spell out each of them. He spelled out their names. He told us their causes. He told us their symptoms of each of them. So let us know which of them exactly we are looking at. It will help him know the right products to tell you so that way we don't mix things up. So Mrs. Bennett, if you're still watching, let us know. You don't have to know the name, but you can share the symptoms with us. Do you understand, man? So that way you will help. Okay, so let's go on. Now, Queen T. Omalabake says, what are the differences between arthritis and rheumatism?
Okay. Arthritis has to do with joints, and rheumatism has to do with bone.
Simple.
Very simple. So arthritis has to do with the joint, the condition, the disorder with the joints, which has to do with the flow of muscle, blood moving to the muscles and some parts of the body. Like we said earlier, why rheumatism has to do with the bone, the skeletal part of the body, the conditions that affect those parts of the body, the bones. So that is rheumatism.
Okay, I hope we get that. Now, this one is very urgent. Okay, it says, from Princess Inena, please, I need what to treat rheumatism with. Okay, she says she has administered jointies, she's a consultant, she has administered jointies, she has administered Calmazine, she has administered Golden 6 for some weeks, she didn't tell us.
Okay.
She said, I said, for now, no results.
Okay.
What can she do?
So one is that let us know the type of bone problem the person is experiencing.
I think sometimes
So some of the time we mix them up, believing that this is, you can use the approach for A, for B. Sometimes you don't know the difference. Meanwhile, they are two different things.
Yeah.
So I have once attended to one of my clients before that was experiencing the pain at the thumbs then, and even when the person went to the hospital, they told him that he was having arthritis. It was even like arthritis, and when by the time they did the scan on him, they get to know that it was traced to his kidney.
Oh.
Traced to his kidney, which they recommend a lot of drugs. He used them for a while and still does not get the results until he came back to us and we attend to the person. Today, the man is about 64, 65 years old, and he gets better day by day, and the man complains such. Again, that's about 4 years ago, 5 years ago. So, but because you can't just treat somebody when you don't know the main cause, the roots. So it's until when you know what you're actually addressing, that will help you with the right product to administer, to give the person to get a solution of what you need.
Okay, she actually said it's rheumatism.
Rheumatism, so bone problem. So in rheumatism, then the treating this, that is inflammation. So number one, you have to do with constylis. You have to get constylis, have to be there. Then you don't have to be believing that, oh, no. Because anything you want to do with bone, don't forget the fact that that person for expressing that they have been a year since day one, you have been using that bone. now is coming. So the person need Constellis to use, then the person need Reishi.
Okay.
Because we're talking about infection that affect the bone here now. So the person constantly need Reishi, then the person need the joints and much of warm water, not just water, warm water. In fact, it's advised for the person to take about 4 to 5 liters per day of water the person needs, and the person should eat his food. If there is no excess weight, then if there's any person needs to cut down. If not, the person should make sure that he has 4 hours of food to break to when he wants to sleep at night to solve that issue.
Princess Nina, thank you. All right, the next one I have here. Okay, before I consider your questions, please, if you still have questions, make sure the comment section, send in your questions, and I will take them, I promise. Okay, but let me run through these announcements. Now, our 2023 July special offer will be ending in the next few days. Yes, the offer will be ending on 31st of July, 2023. Have you participated? You that are watching me, then have you participated? Okay, so don't forget that all you need to do to participate is buy 10 packs. That's one set of 7-layer sanitary pad. That's one set, okay, as contains 10 packs of the pad. So when you buy that one set like that, you will be given 2 packs of panty liner. Okay, please don't sleep on this because this offer will be ending in the next few days. This 27th, it will be ending in the next few days. I beg you, after this podcast, visit any, you can come to our head office and go to the closest training center, okay, to make your own purchase. Not because it's end now, you're not gonna ask me, is it still on? No, don't do that to me. Okay, please make sure you get yours so that you can also win. Now, Kelly 2024 car what promo is still on. You know, some of us are acting as if that promo is not on. Promo is on. No. Don't wait to start saying. Don't wait to start saying people collecting their cash. They don't do that promo. We don't. It is on now. It is on now. Please jump on it. Don't be told. Don't be told. Not when people start coming to the head office now to take pictures with their cars and start posting it. Like, when did this happen? And you are so shorting me. No, the promo is on now. Please jump on it. Okay, the promo requirements are on all our social media platforms. Please go there, check it, know which one you can possibly attain, and please jump on it. And if it be you, I can't wait for you to come next year to come and take pictures with your car here at the head office. I can't wait. I will feature you in any of our any edition of Talk to Get Just now. So please jump on. What I'm saying is just participate in the promo and win. Okay, I want you also to win. Now bear in mind that our OPP seminar, our foundation training and product training, they hold at our training centers and some of our regional offices every month. Please attend so that you can learn and then you grow. Some of these things we are talking about, some of these products, you can learn them at our product training. So please attend training as a Kelly Distributor. It is very, very important. Then all editions of Kelly Distributor magazine, all of them are still available. You need anyone, just visit our training center, any of our training centers or our head office to get your copy. Don't forget that you can now watch videos on KDK app. Have you tried it? Okay, because I've been announcing it for some weeks now. Have you tried it? If you've tried it and you have seen any of our videos on Kelly app, please let me know. I want to know in the comments. I want to be sure that you take seriously some of the things that we say on this broadcast. So please make sure to watch any of our videos that you wish to on KDK app. And then of course all our social media platforms are active round the clock just for you. All our social media platforms are active round the clock for you. Okay, you're not following us on any of our handles. This is the best time to do so. On Facebook, we have an account, Kelly Headquarters Lagos. On Facebook, we have a page at Kelly Healthcare Industries. On Instagram, we have an account at Kelly Healthcare _official. On Twitter, we have an account at Kelly Health NG. On LinkedIn, we are at Kelly Healthcare. We have a YouTube channel. Just search for Kelly Healthcare, subscribe to our YouTube channel, and have unrestricted access to all our videos. We have a mobile application, Kelly Care app. If you have not downloaded your own, please do so today. Not forgetting our website, www.kellyhealth.com. All of these are our information platforms, okay, through which we send out information to you. Please ensure to follow us so that you can be up to date. Okay, thank you. Now, before I take my Dr. Cat tip for this edition, let me take a few more questions and then we'll be on our way because time is not our friend. Now we have this from Nkiruka Onyekwe. Okay, I will join these two questions together because they mean almost the same. The question from Nkiruka Onyekwe and Olamide Rukayat. What can be used to remove the pain caused by arthritis? That's from Nkiruka. Now, Olamide Rukayat, what is the difference between bone disorder and arthritis? I think we talked about it. Yes, Mr. Sheikh talked about it some minutes ago. Okay, can Kelly products work for arthritis? Can it work for bone disorders? Okay, so let's take those questions again.
Okay, talking about the arthritis, we have product for it. But one thing is that, like we say, that prevention is much cheaper and easier than the treatment. But because most of the time people are experiencing this bone issue or having any of these ailments, either bone or joint ailment issue, they tend to feel like, oh, they experience a lot of pain. So at that moment, what they need is like anything that can address the issue. That's what they want to take and they want to use at that time, which make most of them that even experience these issues to have more complicated ailments.
Okay.
So one of the things is that some of them, most times, they tend to take most of the drugs or medications they are not supposed to take in excess, or they even abuse some of them, like some of the pain relief. Because one of the things that they address that the medical will tell you to take as somebody experiencing this is to take pain relief and all that. So, and taking all of this, you are affecting your body chemistry and all that again. So, which one of the time, it's even when, for example, now when you take one of pain relief, excess pain relief, it causes what we call, pain relief contain what we call NSAID drugs, which mean non-steroid anti-inflammatory drugs, which make your body to be too acidic, and which one of the things that even cause gastric ulcer. And that's one of the reasons why most people that experience this bone problem and joint disorder, they tend to, at the end of the day, over time, experience ulcer. Why? Because what the medical can only give them, administer to them, is pain relief to subside. But Kedi Healthcare, we are telling you that there is a solution to this ailment you are experiencing. So for the arthritis, you have to first engage in activities that will help your vein to be active. That will help your vein to be active, to be back, to function, to bring out blood, to circulate blood to the general body system. So which you have to do. So you won't be having what we call adding of the arteries. So you have to do that. What are the things you need to do? After you do exercise, then we have our cordial jelly. Helps on that for the blood flows. Then the marginal I talked about. Then ultramegal as well helps for blood flows. So all this helps in the arthritis section to treat. That's why I said the products you're going to use for this might not work for another one. So we're talking about arthritis now. You need cordial jelly, you need ultramegal, you need joints to take to help to address the arthritis.
Okay, thank you. So, Adisa Adeniyi quickly on Instagram is a comment. He said, I think ultramegal also helps for joints. Yes, he just mentioned that. And he said, joint prevention and lifestyle habits, I think cold water should be avoided.
100%, which I've mentioned that the person should live on warm water. Warm water.
Okay, thank you, Mr. Adisa. Thank you so much. Okay, Olamide Rupayat. Okay, can someone with arthritis use both joints and golden cysts together?
Okay, arthritis, joints, and golden cysts. Yes, the person can use both together.
Okay.
It goes along.
That answers it. Then, Tayo Adeonepepe on IG. Do you discontinue the use of joints after a week of a course of treatment? Okay.
Kelly puts a caution there. Joints, you take 3 morning, 3 evening with a lot of warm water. So after 1 week, it's advised you hold on for about a few days. So to see if it has actually done the perfect work. So then if not, then that's when you now come back. So once you take that, because some persons, based on the body chemistry, sometimes somebody is using it, you can be feeling some things, we call it like healing crisis.
Okay.
So in the quest of taking it, you can be feeling some of all those things. So but once it's after 7 days, it's advised you hold on. Not to take for about 3, 4, 5 days or a week. And then you just based on your warm water. If I don't bring this try solution, then you now come back to it to continue to be taking.
Okay, so Benny Apache has sent a response to the question we asked. She said she thinks it's osteoporosis.
She thinks.
She said the pain comes from the waist to the tissue of the leg.
Okay. So we are working on assumption now, not that we are certain. She thinks it's osteoporosis. Like I said, osteoporosis has to do with the bone. Which most of the time, let's ask the person to go and check his or her sugar level first to know. So if the glucose level is high, then we have diarrhea and golden cysts to address that, to bring the level of the sugar to normal. Then we can now work on the bone. So by taking joints, then by taking Camazine. Because somebody is having osteoporosis, like I said, you can even experience that. You notice that you're reducing in your eyes, and even lose up to 6 inches of the eyes. So which we need to work on. So if the person wants to work on that, check the sugar level. If the sugar level is normal, then we now just work on the bone itself, which is joints, which is golden cysts, and Camazine will address such case.
Okay, so because of time, let's make this the last question. Thank you. Demovis Creations on IG. Which Kelly products do you recommend for fibroid, and for how long will the treatment last?
Wow.
Let's make that our last
question.
question.
We are done, which means we are done with, or our people are cleared with joints and bone, and we are moving to fibroid. We're talking about fibroid. This is just like, let me call it a bonus.
Yeah, exactly.
We're talking about fibroid. Fibroid we have 4 types of fibroid that we need to look out for. We have, let me remember now, we have 1 type of fibroid which we need to look at, but most of the fibroid has to do with excessive on estrogen. So you have to first correct your estrogen. Okay. So your level of estrogen must be normal. That's what we're talking about, your hormone. Because fibroid has to do with is what your baby use, what you eat. So when we're talking about fibroid, it's just like the same thing that when somebody that is pregnant. So what it feed on, the same thing fibroid feed on. The only difference between pregnancy and fibroid is that fibroid cannot call mommy, cannot welcome daddy. And you can't say, oh, I just gave birth to fibroid. You can't allow that. but you are experiencing fibroid, and it's just like the same thing like if somebody is pregnant. So in having fibroid, then your hair, type of hair, now remember we have submucosal fibroid, so submucosal fibroid and some other ones. So we have the one that causes protected tummy, the pediculated fibroid. They are 4 in numbers. So when you're having any of those, first and foremost is that you have to first run a scan. Those who work on old scan, on old results, have a scan, because every woman they tend to experience a hormonal profile change in every 3 months. So you have to run a scan. So we have the updated scan. We know the type of fibroid the woman or the lady is experiencing. So if it's an old age, if except it is a pressing issue that is affecting the person, that is affecting that person, that is causing a lot of distress, that is when we can say, oh, maybe you need to use a medication, or you need to use, or you need to go for operation. Because when it's an old age that does not experience anything, you are not feeling any issue at all, you don't need to bother yourself. Because once as a woman is getting to menopause stage, the estrogen begins to change to testosterone. So once it changes testosterone, then the fibroid will just be at one position, it's one grade, and sooner or later it will get males over the time on its own. But at a childbearing age, and the person is still giving birth and is experiencing the fibroid, then we have any product that the person can use to address those ones. So after the scan results has been done, and we have it, which we are going to first place is on some of the diets and lifestyle that will increase the fibroid estrogens, which is to avoid anything that has to do with draw soup, like ogono, ila, them and all that. We will do all those ones. So you have to do away with them. You have to do away with egg, either fried, boiled, whatever you call it, omelette. You have to do away with that. You have to do away with meat. You have to do away with stress, milk as well, milk, milk. Then we have to do away with minerals. So drinks, all this increases the level of estrogen. Because if you are only on the medications or the products and you don't do away with all this, the products will only be working on what you are eating now. You need to work on the one in the body. So but once you do away with this, then your level of treatment will be much more instant and fast, and within 90 days there will be total solution. So
the product.
Golden Alpha, Reishi, Ultramega, Giant Alpha, and Eve's Comfort.
Okay. Time is actually not our friend. Then let me take another tip for today. It says keeping your joints healthy is important at every age, because a healthy outside starts with a conscious decision to be healthy and live long. Please take care of yourself. Nigeria be as it be, but we need you alive. Johnson, your loved ones need you alive. Whatever you do, no matter how busy you are, no matter what it is that's happening, ensure to prioritize on your health. Because it is that health, when you have some health, that is when you can work hard to get wealth. Please take care of yourself, okay? I'm Sarah Adenor, and till I come your way next time, don't forget, I always say, take care of yourself. And this is where we call it a day on this edition of Talk to Kelly. In case you tune in late, ensure to watch the full video on our Facebook account, Kelly Headquarters Lagos, on our Facebook page. I mean, after this live broadcast, the full video will be available on our Facebook account, Kelly Headquarters Lagos. It will be available on our Facebook page at Kelly Healthcare Industries. It will be available on our Instagram account at Kelly Healthcare_official. It will be available on our YouTube channel, Kelly Healthcare. You can also watch it on Kelly Care app after this live broadcast. Thank you so much for watching. Special thanks to my guest, Mr. Shegun and Jai. Thank you so much. Thank you. I hope I will invite you next time. You really.
Sure. Sure.
Thank you so much for watching. Thank you. If I was able to take your question live, I am so sorry. Time is not on our side. Thank you, and join us for the next edition. Bye for now.